All right, hello and welcome to our first session, our first webcast regarding return to performance programming using the NASM Optimum Performance Training Model. So I am Ken Miller, and I am one of the instructors for the National Academy of Sports Medicine, and I am joined here today with Mr. Tony Ambler-Wright. And so just a quick explanation of who I am and what we're going to be discussing today, and then I'll let Tony go ahead and explain who he is and the vast experience that he has in the field of return to performance. My background is I've been an instructor with the National Academy of Sports Medicine for the last 12 years, and I do teach live workshops, not just for personal trainers, but also sports performance as well as corrective exercise. And my background stems from not just in the field of strength conditioning, where I was a strength conditioning coach for the University of California, but I've also had a few years experience in the physical therapy environment. So from there, I've had the great opportunity of working with athletes as they've unfortunately incurred injury through the season, and whether it's through practice and play or through the competition itself, getting them ready to come back into integration with the team and eventually back into full competition. But also from the other end, when we talk about the rehabilitative process and how do you get somebody from the hands of a physical therapist and then giving them the tools they need to get back into full practice and full play. So not only have I had the formal experience from a Division I and a professional athletic performance standpoint, but also from a rehabilitative standpoint. Now, my background practically as I come from a personal training environment, I've had over 24, 25 years of experience in the field of personal training. And so when we do this series on return to performance, the examples I give and the experience that I share comes from either one of those basic backgrounds. So I know that my associate Tony Ambler-Wright here has a lot of contribution to this information as well, which is why we're here together. So Tony, you mind explaining who you are and all the great things that you've done in this industry?
Thanks so much, Ken. Hey, everyone. To all of you watching and listening, really excited to be a part of this series on return to performance. A little bit about me. Fitness industry veteran of about 20 years, got my start in traditional personal training and was fortunate enough to join the NASM education team in 2005. So for the better part of 15 years, I've been facilitating workshops on the OPT model in fitness, sports performance, and corrective exercise. My career kind of evolved and got out of traditional fitness probably about 10 years ago, where I was afforded the opportunity to get involved working with athletes in the elite sports setting, primarily basketball, but also in Major League Baseball. And through that process there, was exposed to reconditioning and return to performance. So many of the clients that I worked with, as a byproduct of performing and training at a high level and competing at a high level, would encounter injuries. And so part of what I was responsible for was not only, helping them to perform at a high level, but also at times helping them return to performance along the way. So, integrating the NASM OPT model, the concepts that we present in the OPT model, as well as corrective exercise, and helping them to kind of transition from, let's say, the rehab or post-rehabilitative phase back into full training, practicing, and competing. So, with that, what we hope to cover today is, give you an overview of, what is return to performance or return to play if you're looking at the athlete specifically. Talk about what that is, maybe highlight some other terms that are used related to return to performance, get into some different considerations and some of the things that you'll want to do from a program design and program application perspective for a variety of different scenarios. So we'll highlight, again, what is return to performance? What are some of the different scenarios in which you may be involved as a fitness professional, if that's your background. What are some of the other professionals that are involved in the return to performance process? How do you create that multidisciplinary team where you may have to collaborate with a variety of different individuals along the way? Then we'll go through, what does the return to performance process look like, and what are the things that are taken into consideration? What are the things that you need to do in order to ensure that you cover all your bases and you do everything necessary to help that individual get back to the level that they were at before, or even better. Ken, what else am I missing here? I know there were some key things that you wanted to address in this first episode in the series.
Yeah, I mean, basically you touched on it. And I think, when you and I, Tony, first talked offline, the one thing about return to performance, and we initially called it return to play, but return to performance was, I guess, more appropriate when it comes to getting an athlete, especially a higher level athlete, back to in full competition. I mean, there's just a lot of information when it comes to this, because, to get somebody from the rehabilitative process into just a regular strength and conditioning, and then to with full confidence, get back onto the playing field. I mean, there's just a lot of information there. So I think you summed it up really well when it comes to the objectives for the program, which is why this is a series and not just one episode, right?
Mm-hmm.
So
yeah, exactly.
Yeah. So when it comes to this, and I think one of the points that we really need to get out there, especially when it comes to, I guess, a lot of our listeners are going to be mostly personal trainers by trade. When it comes to this webcast is, what's the difference between just simply talking about corrective exercise and return to play, return to performance, or sports reconditioning, just to kind of lump up those terms, and that, for the most part, when it comes to return to performance, we're talking about getting somebody who's been compromised physically. And the extreme example is somebody who's had surgery or has had some kind of debilitating injury. And how do you get that person to compete at that previous level, when they got injured, or if not higher? So an example of a high school player who got, some kind of knee injury and wants to perform in college or from college and still perform better at the professional or amateur level. So, when it comes to that side of things, when we're talking about the term return to performance, how do we get somebody back in the mix, performing at the very least, but not at least better, because what we want to do is, if you were at a certain strength level, stability level, or power level to begin with, obviously you didn't have the requisite strength or power to compete at that level, right? So what we're trying to do with return to performance is to get you where you were, if not farther, so that you can definitely withstand the stresses of sport to begin with, using, like what we talked about, corrective exercise with a sports performance kind of accent to your training.
Yeah. Absolutely. Well, I think the other thing too, Ken, you mentioned, our likely audience for this webcast series, and I think many of the things that we'll talk about will be through our lens. Again, not only working in collegiate and professional sports, but also in the fitness environment. You're going to encounter clients who compete or perform certain sports recreationally, and this can certainly extend to that type of individual as well. If you think about a client who may have nagging ache or pain at their foot, ankle, their knee, their hips and low back, and that's compromising their ability to do what they enjoy doing from a sport standpoint. Many of the things that we'll discuss would also apply to that individual. And so what are the things that you can do from a corrective exercise standpoint, as well as, a training standpoint, to get that individual to maybe feel better, minimize the pain and discomfort that they're experiencing, and get them to the point where they can enjoy the different sports and physical activities that they want to participate in.
Right. And I think, when we talk about the philosophy of, what we're trying to do here is and you bring up the word, feel better. I mean, that's a hashtag, feel better, hashtag move better, when you watch social media. So first and foremost, if you don't feel good, you're not going to perform well, because you're going to build up these movement apprehensions or compensation patterns to avoid pain, and that's one of the things that with movement efficiency, if we're trying to get somebody to move with better range of motion, with stability, with strength, and with some speed and power, we have to have you move with confidence first when it comes to getting somebody to perform at that high level, and then it's a matter of playing better as a second level of priority. Because if you move well, you're going to move well through not just through that, say, 1 hour of working out, or that 1 hour of practice and 1 hour of play. You still have another 23, 22 hours rest of the day to avoid compensation patterns. So it's health first, performance second when it comes to the level of priority or the philosophy when it comes to return to performance. Because we have to remember that, athletes, they are people too, just for lack of a better way of saying it. It's like, you want to move well on the court, but I also have to move well when it comes to getting out of bed, putting away the dishes, mowing the lawn, things like that. So when we talk about, return to performance, we just have to talk about return to being human and getting away from pain and discomfort.
Yeah, no doubt.
Right.
All right. So let's get into it, huh?
Yeah. So I think one of the biggest things when it comes to understanding this process is when we're a personal trainer, when we're a strength conditioning coach, there is a certain level of scope of practice, right? There's what we've shown competence in as far as passing a test through the National Academy of Sports Medicine, having a specialization, or whether you're a strength conditioning coach or a massage therapist, there's certain lane that you are qualified to go down. But when it comes to getting somebody back into play, I mean, there's a lot of cooks in the kitchen, if you will, when it comes to getting an athlete back into play. So Tony, you want to talk about your experience and what we need to consider as performance coaches on what it takes to work and collaborate with other professionals that may be working with a respective client or an athlete that's in our midst?
Certainly. Yeah. And I think, you said it perfectly. We need to understand our role in the process, especially if, you're a personal trainer. Depending on where your client is in the return to performance process as well, you've got to understand that there are other professionals that are going to be involved and have opinions and perspectives on what the client should do in order to get better and get back to where they were. And so for me, as a personal trainer, massage therapist, some background in strength and conditioning as well, in the clients that I worked with, everything was driven through the team. And so, the team physician, the doctors, they're going to have the final say, final word on what happens with that particular client. But then there's also the physical therapist, rehabilitation coordinator, director of performance, the team strength and conditioning coach, if you're operating independently of that. There's the athletic trainers that also have a hand in what's going on. And then you also have to look at the coaching staff. So there's the not only the coach and assistant coach, you've got skills coaches or player development coaches. You might also have front office to deal with at that level, or the administration to deal with at the collegiate level. So there's, as Ken mentioned, there's a lot of people involved in the return to performance process. So understanding where you fit within the complexities of all that, and making sure that you communicate exactly what you plan or what you have done with the client throughout that process is going to be critical. And I think the key to collaboration is communication. So making sure that whatever it is that you're doing is fully communicated to the other stakeholders involved, and that whatever guidelines that they've issued, any objectives that they've communicated to you are being met as well. I think that's going to be of utmost importance. So regarding physician, the doctor, that could be the surgeon, even depending on where you are in the process, they're the ultimate decision maker, and essentially whatever they say goes, and you have to kind of operate within the bumpers that they've provided. And then from there, that'll trickle down to some of the other individuals that we've mentioned. So, for me, it was all about communication, making sure that whatever I was doing with the client or the athlete was vetted to a certain extent by the key stakeholders involved, and that I was communicating exactly what I was doing. We'll talk a little bit more about it, I'm sure, towards the end of this session, but that's where the opportunity to perform assessments and provide regular feedback on progress is going to be important, and letting whoever needs to know where the client is at before you work with them, as well as where they're at after you work with them, to ensure that everybody knows, hey, this is the progress that was made or not made, and how do we adjust and modify from there if needed.
Right, and that's one of those things that I really cherish about one of the things that I've done and working at the university, is that we actually had sessions where we would sit down. So it'd be the head coach, the athletic trainer, myself as the strength conditioning coach, and the nutritionist, right? So if there was an athlete, and I won't name any names or any sports specifically, but if there was an athlete who was coming back from, let's say, an ACL tear, we wanted to know things like, okay, well, what are the limitations from the doctor or the physician? And then what, okay, if there was a limitation of they can squat but not lunge, for whatever reason the physical therapist or the doctor placed those limitations, then that's something that as a strength coach I had to do that. So if I wanted to squat or some variation of a squat, I could do a ball wall squat, but there was no lunges. But then that would spark me to ask questions like, well, is that just a forward lunge, or can they do a side lunge? Or can they do a lunge maybe half a range of motion, or can they do a side lunge without pain? And they might say, okay, no forward lunging, but I'm okay with a side lunge with so many degrees of flexion in the knee and the hip. Sure. And then, but the other part of it,
what are some alternative patterns that can be implemented and stay within those limitations that have been provided, but still get some benefit for the athlete. Yeah, for sure.
Yeah. And then the other side of things is that when you have the athletic trainer who's that, they're that go between physical therapy or the physician and strength conditioning, this is where you also need to figure out, okay, well, if this athlete is at practice and they're doing a bunch of core work, a lot of balance work, just as a sideline type of activity to keep them busy and to strengthen up those deficiencies that they've had since the injury, then if I'm making modifications in the strength and conditioning room, in the weight room, then I want to make sure that I'm not doing double of what the athletic trainer just did. So if they're doing balance work, core work, and then they come to me and like, well, there's no squatting, no lunging, then guess what I have left to do? Well, maybe I'm doing a little core work, some flexibility, some balance work. And there's been a couple of times where it's like, all right, what have you been doing with the athletic trainer? I was like, well, this is what I did. Well, darn, that was what I had planned for you. So we could have
I've never experienced that before either.
Yeah, exactly. So from that standpoint, then it's like, okay, well, if they're doing that with you, then hey, we can do this in this environment. So that way, we're always compounding and building upon the progress that we made. So in coordinating with, to your point, if everybody has a role, we can complement each other and see that we are, we're just adding and progressing whenever we can. So if somebody's doing, flexibility in one session, then we can work on core work and maybe some dynamic movements in another session, and making sure that we're keeping the athlete engaged because we're constantly challenging them. And that is one, a confidence builder. And two, it's just, we're just adding to their arsenal of movement strategies that they can incorporate on their own.
Yeah, no doubt. Absolutely. I think, we may get into this a little bit more. I know we'll certainly get into it in our subsequent sessions, but that's where looking at opportunities to improve other areas of the athlete's development or client's physical development. So, you might be limited in terms of what you can do directly around the site of injury, but they've got other parts of their body that could need that may need some work, and you might need to level up as well. So what are some things that you can look at from a kind of a kinetic chain, or in our new CES, we talk about the regional interdependence model. Even though the injury might be, let's say, to the knee, in the rehab process, and as part of the reconditioning process, if things aren't being done around the or to the adjacent areas, let's say around the hip or at the ankle, are those areas that you can exploit and focus on if some of the other things that you had in mind or were planning on doing were already addressed with other members on that team as part of that collaborative effort. So, we know that, ankle range of motion is going to be critical for, somebody who is returning to performance from some type of knee injury. And so if that's not a primary focus of the process with the other individuals on the team, then you can be a great complement there by ensuring that the ankle's moving well, the hip is moving well, they've got good proximal control and stability around the hip. And that's just going to accelerate or, be a great complement to what other things are doing in their program.
Right. Exactly. And you say it, really efficiently there. It's like, whatever the point of injury is, that's what gets a lot of the love and attention. Right. But again, when it comes to regional interdependence, an issue with the knee could have been because of lack of ankle dorsiflexion or lack of hip stability, range of motion, things like that. But one of the things that I saw, Tony, and you can share this as well if this has been your experience, but a lot of times when somebody does, let's say, an example of a single leg squat, it's the compromised leg or the injured leg that upon reevaluation 4 weeks, 8 weeks down the line, that looks like, if I'm doing a single leg squat on the right side versus the left side, a lot of times it's the rehabbed hip and knee that looks awesome. And it's the, quote unquote, healthy knee that sometimes looks not as good, or it looks like that could have been the injured leg to begin with. So if somebody had gone through physical therapy and that right leg, let's say if that was the injured leg, that's the one that's been getting all the love and all the attention and all the manual work and all the strengthening. But meanwhile, you have this left leg that's kind of just been dangling in the wind. So as a personal trainer, strength coach, if you realize that the opposite side or the uninjured side isn't moving efficiently, that's an opportunity as a performance coach, rehab coordinator to look at, okay, let's look at the whole body, see what's available to be worked on or what should be worked on to help get the whole system working in tandem at that efficient total body movement pattern.
Yeah, exactly. I agree with you 100%.
All right.
Definitely seen that.
Yeah. And I think, the other thing that, outside of the allied medical field, physical therapist, surgeon, athletic trainer, one of the things that we as personal trainer, strength coaches also need to look at is, other forms of movement and exercise that your athlete may be involved with. For example, if you have somebody that loves to do Pilates or loves to do yoga or they love Zumba, right? These, yeah, I wouldn't be me, but I love the music, but I couldn't do it. But from the standpoint of, okay, if somebody does, let's say they're on a reformer, they're on a Pilates reformer, and they just got done with they did a workout session that morning. And if they have an afternoon session with me, that's another thing that I want to be able to kind of throw into that pot as far as the information that I need to know and understand about, okay, what has their body physically been involved with? And so what can I add on to, or what do I need to back off of on my own? So again, if I have flexibility as part of the priorities and somebody does yoga, I want to know what poses that they've done, because if anything, you just want to, again, support them and make sure that they're doing the right yoga poses versus somebody that can be putting more stress onto their system than I feel comfortable with, depending on where they're coming from with the injury.
Yeah, absolutely. And you mentioned something really critical there too, is that, you may have to back off of certain things, depending on where in the process and at what level you're doing this. The athlete or client, might be getting pulled in multiple directions. They might be interacting and working with a variety of different individuals. By the time they get to you, it may be too much, and so you have to figure out, okay, what's critical for this person. What can I do that's not going to overload them further, which could be detrimental to the process as well. So that's where communication is key, really having a full understanding of everything that they're doing in the schedule, and ensuring that you can make the appropriate modifications so that you're not a wrench in the wheel or a wrench in the cog, so to speak, and doing things that could potentially set the process back. More isn't always better, especially as you're taking somebody through this process.
Right. Now, Tony, you've had a lot of experience at the professional level. Now, if you had to talk to the team athletic trainer or the team physical therapist or whoever the decision maker is, if you're trying to figure out, okay, well, what does this player need from me today, right now? What are some of the questions that you ask? And I'm asking you that because I'm under the thought process of, great questions, great quality questions means great quality answers. And by that, it means, okay, the more that I know about what needs to be done, the better I can apply what I know to this person and getting back onto the field of play. So what's one of the top two questions that you might ask somebody else in the allied medical field, as far as what you need to know to do the best job you can with the intention of the athlete in mind?
Sure. No, I think the first question is what shouldn't I do? Is there anything I absolutely should not do?
Right.
What is completely off limits? Really understanding, the full scope of the situation, and what are the considerations and things that I need to be aware of, so that, again, I'm not setting anything back with
Okay.
what I'm doing. That would be the last thing that you'd ever want to have happen is be responsible for a setback. So what are the critical things that I need to know to not do or stay away from, and that I need to take into consideration when putting my programming together? And then, I think the other thing is just ultimately making sure that I'm clear on what the team's objectives are, or the team staff's objectives are. What are the key milestones that they're looking for the athlete to hit, and before they feel comfortable with them moving on to the next level. And then that way I can ensure that I'm as supportive as I can be in that process. And if I'm aware of key dates, key milestones, key objectives on their side, then it makes it much easier for me to figure out where I can fit most appropriately in the process.
Right. All excellent things. Like, one of the things we talked about is, as far as communication goes, and what is the ultimate goal for this player. So if we are in season, one of the things that, you and I talked about, and one of the things that I wanted to know from my coaches is, okay, this person's had an ankle sprain. Are we aggressively trying to get this person back to a playing level? Right?
Mm-hmm.
We want them on the field. Would you rather have this person go at 80% and, still be the starter? Or are we going to shut this guy down because the second string player is good enough to take on the position? So, are we, what's the timeline?
For recovery? Yeah.
Mm-hmm. Yeah. So are we really trying to get this person back immediately, ASAP? Or are we going to shut them down and do the process? And I think, when it comes to communication, one of the things that you're talking about is, as far as I'm interpreting what you're saying, is, okay, what's the intention? Where do we want to be, and how fast do we want to be there, or what's the strategy to get there? And, just as much as I want them to know what, how much I want to know what their intentions are, they should know what my intentions are. And I remember one situation where I planned out, as much as you can plan, right? I think Mike Tyson, to quote him, he said, everybody's got a plan until they get punched in the face.
Right. Yeah.
Right. So,
exactly.
so, I can lay out a 3-week plan or a 4-week reconditioning or return to performance plan. And then I get to the first session and then I'm just, no, can't do that. Or can't do that. But you know what? They're in better shape than what I had originally anticipated. So I'm going to bump it up a little bit so that we can keep the progress going. So, and I've had coaches and I've had physical therapists say, hey, that's awesome, right? Keep it as is. Or I've had the same people say, you know what? I do not know what that means. And I don't know where you're going with that, but this is where the bridging of communication comes into play. So when it comes to, what I asked you earlier, is like, okay, what do we want to know? What do I want to know to help better serve? But there's also the feedback loop on, okay, well, based on what I understand you want me to do, here's what I want you to know about what my plans are, what my intentions are. So being kind of forward thinking and then sharing that information winds up being pretty important too, because then you start to have that conversation of, okay, well, what do we have available, and how are we, what assets do we have, and what are the parameters, what are our, what you said earlier, what are our bumpers, to help keep us within our lane, so to speak, in that rehabilitation or that post-rehabilitative process.
Yeah. And going back to your question, what questions would I ask? I think another critical question, and one that I always make sure to ask, maybe as the first thing, is how can I best support you? So if I'm talking to somebody on the staff, whether it's the physician, or most often I wouldn't directly interact with the doctors, I'd be directly interacting with the director of performance for the team, or the rehab coordinators. What can I do to best support you in the process, and what your goals are for the athlete? And it is, you've got to recognize, again, your place in everything, and while you're there to serve your client and the athlete, you have to understand that you're a part of a much larger team with other aspirations and objectives, and you have to be able to support that and let them know that you're there to support them. And I think everybody has the ultimate outcome in mind, which is, to get the athlete back to performing at a high level as soon as possible. And so that's going to be critical too, is that you don't want to be perceived as, this rogue provider, practitioner, coach that is working against the other stakeholders involved, and that you're there to facilitate and facilitate their goals and objectives as well, and to support that process.
Right. Exactly. So Tony, with the fact that you've interacted with teams and you've worked with individuals, what's one of the key things that, and I'm doing this because I want to know how you function, how you work, considering all that you've done in the industry. What are some of the things that you want a allied medical professional to know about your thought process and your how you facilitate the return to performance service that you offer?
Yeah, no, it's interesting. It's not too complex, and I think that's the great thing about the NASM models that we'll be highlighting through this series in terms of corrective exercise and the optimum performance training model, is that, by following a system and implementing a progressive approach to how you interact with your clients, it makes it easy to describe and explain exactly what you might plan on doing with the client through the process. So when it comes to assessment, understanding the data and the assessments that have already been done, and then how you can support that with some of the things that you might be better equipped, or some of the things that you might be more comfortable with implementing. So for me, it was, when applicable, being able to perform certain movement assessments, and then we would utilize isolated range of motion testing, goniometric assessment as part of our process. So basically, performing range of motion assessments lets us know segmentally where there might be limitations or deficits in mobility, and we would use that to directly guide the program that I would put together. And so from a therapy, reconditioning, corrective exercise perspective, that's what I would go through with the other members on the team. Say, here's the assessment process I use. Here's what it tells me, and I use that information then to put together the program that you see. Basically, if this, then that type of scenario. And then from a training standpoint, just kind of walk them through the levels of the OPT model, from stabilization, strength, and power. What my intention is by incorporating those different components and elements, from core, balance, plyometric training to integrated and functional resistance training. And that served me very well. It made it very easy, leveraging, periodization and, planned programming to kind of explain my approach with the client, with the athlete. So I don't know if that answered your question completely, but, it wasn't too complicated. It wasn't too complex, because I'm not, the simpler you can keep things for me, the better. But,
right.
Basically, here's my assessment process. This is the criteria I use to determine the programming. This is how I implement the programming. And from a training, strength and conditioning perspective, these are the different phases that I utilize, and we'll plan on taking the client through to help them get back to where they were. Right.
No, that's it's a pretty comprehensive strategy, and one of the things that I find, and because we're cut from the same cloth when it comes to utilizing the training model that the optimal performance training model that NASM promotes and teaches. But and I think that for the uninitiated, your explanation is basically what I've had to have discussions about. Both from on the bookends of things, right? You have your rehabilitative team, right? Mm-hmm. Physical therapists, physicians, and then you have your sports performance as well as your sports specific coach, and then you're that person that bridges the gap through all of that. So I think with what you're saying, it's like first we want to work on where are we deficient in movement strategy, and then how can we make that better, and then how do we progress the intensity from stability through strength into power to where now if I'm a lacrosse player, how well can I control that change of direction and re-accelerate into a different direction. And then now I've got my lacrosse stick, and now I've got to be able to contort my body so I can get enough rotation to, pass the ball or take a shot. So, and letting, how do you communicate that to the physical therapist? Okay, well, this is where we need to go or have to go and be able to do it with this injury, through that process that you talked about. So again, with a certain level of assessments, you're going to complement the information that's already available, give them more information that, okay, I understand that, they're at 40 degrees, knee extension where, optimally we want to have about 20 degrees knee extension. And then from that 90-90 position. But if that is more information than what they have to give to you, and you're giving them that feedback on what you found, then I think everybody's in a better position to make decisions. And but you can also feed it forward to the performance side of things or the sports coach and say, hey, I would love to get them onto the field, but based on what I'm finding, they've got they've got 40 degrees on this knee, but they only have 40 degrees on this knee and they have a full 20 on this other knee. So that's going to lead to, unbalanced loading, compromised hips, as far as how you're going to push off of one side versus the other. Lumbar spine is going to be loaded, the spine is going to be loaded differently. So when we talk about, that communication and what you want them to know, I think, just adding to the bigger picture, because it's all a puzzle, right? And all we're trying to do is just put more pieces so we can have, get a better idea of what the landscape is when it comes to, getting somebody to perform better. But I think communicating and gathering that information from one bookend to the other bookend, because if we're as return to performance coordinators, if you will, that explanation kind of fills in the gap of what the rehab side may or may not know and what the performance side may or may not know, from that vantage point.
No, exactly. You mentioned the skills development as well. I can think back to a specific client. I hadn't been working with him very long. He was getting ready to get back, report to camp. And so he had a skills coach that was working with him. And a key piece to the puzzle, if you will, as you put it, was working directly with the skills coach to ensure that what they were doing on court and in their sessions was complementing the objectives of the reconditioning and performance training program. So, understanding that, okay, this athlete is returning from a back injury, and there are certain things from a skills development perspective, certain drills and certain exercises that that should be performed with caution or avoided completely as you're going through this process. So, that's another critical thing to consider, is that, on the skills development side, there's certain objectives there and certain programs and drills and things that are performed that may not consider what's being done on the rehab, reconditioning, and performance training side. So making sure that everyone's on the same page and working from the same sheet of music is going to be important in that respect too.
Right. Right. And one more example that, I've seen out there is like when you're working with, let's say, a golf coach, as an example. One of the things that I want to ask the athlete specifically is, you're seeing your swing coach, and what is it about your swing characteristics that your coach wants you to do better? So it's about, getting more thoracic rotation. Then I might say, okay, well, let's do maybe an upper spinal twist, as a static total body, stretch where I'm laying on the ground and I'm just going to rotate my spine, hold that there for about 60 seconds, just to, open up the whole spine with the emphasis of, getting the shoulders to open up, getting that spine to rotate. So, and if I put that on the program, then that's something that the swing coach can actually say, okay, well, that's awesome. That's great. And, and when they go back for their subsequent lessons or swing coach sessions, then we can say, all right, well, if that worked, let's try something else. Or what else can we do to facilitate that desired body position or that desired motion, but if I assess, you can go, the desired range of motion to the right or from left to right, but then you're limited right to left, then that's other things that we can work with on, from a skill perspective, as far as, okay, there's the sport and then there's the position or certain aspects of the motion that need to be facilitated. So those are the things that, I've seen that really helps facilitate, better movement. So not just about getting stronger, but can they do the actual motion specific towards that sport?
Yeah, no, exactly. Makes sense. Well, I think just looking at what we've covered to this point, we've talked about the, definition of what is return to performance, reconditioning, the overarching philosophy of, focusing on moving better first, looking at, injury or re-injury prevention. Not going to serve anybody if the athlete gets hurt in that process or re-injured. The goal to build confidence in the athlete as they're recovering and returning from the injury. And that, secondary to that would be getting them to play better, incorporating sport specific drills. We talked about the collaboration between various stakeholders and professionals involved, whether it's a physical therapist, athletic trainer, chiropractic physician, or the medical doctor and or surgeon. You got the strength and conditioning side of things, other activities that the athlete or client might be involved in, from Pilates, yoga, as well as on the coaching side, you've got your sport coaches, skills development and player development coaches. I don't know if we highlighted this or not, but the different scenarios that you might encounter from a return to play standpoint. So at the macro level, you might be looking at post-rehabilitative return to play or return to performance scenario. In sport, it might be with if you have an off-season scenario, that's going to be one thing. If you have an in-season scenario, that's going to be something completely different, which you touched on that a little bit. And then at the micro level, is there an acute injury that you have to help that individual return from as well? And what's your place in that process? We talked about scope of practice, staying in your lane. As personal trainers, strength coaches, what can be done from a self-care or coach-directed standpoint that can facilitate the objectives of the return to performance program, and what can we do to get that individual back to full practice, full strength and conditioning and competition. So trying to think what else have we covered, or what else do we need to cover in this kind of initial episode. I guess, different techniques and strategies, that would be used in the return to performance process. Kind of focus on that, and then I think that might be a good place to shut it down, huh?
Yeah, I think so. I think from the techniques and strategies perspective, like the thing about this is that think about this process that I think that our listeners need to know and understand about getting an injured athlete back into play is that what we're really trying to do with the system is to be consistent with how we deliver the information or how we apply or practice the return to performance programming. So, and that comes from a couple's perspectives, in that if I'm going to get a referral from a coach or another player who knows another player who's been injured, you want to be able to duplicate, the process from one player to another, just from a consistency standpoint. So if it works for one, I mean, if you follow a philosophy or a system, then it should work on different levels, whether you're a seventh grader who's playing on two soccer teams, or if you're a professional athlete who's been doing the same sport for the last 20 years. So to get somebody back into full practice and full play, you do want to be consistent with how you apply this information. So whether you're in the weight room or you're giving homework, I mean, if you're following the information as it's delivered through the optimum performance training model, you want to be able to, are we going to inhibit or relax, muscles that are doing too much? Are we going to get some length out of those muscles that have just been shortened for, because they sit behind a desk? And are we going to activate those latent muscles or those muscles that aren't doing enough work? And then how do we string it together to get the whole system working as one when it comes to the desired motion, whether it's rotation, kicking a ball, throwing things like that. So when we talked about corrective exercise training or corrective exercise in general, the techniques and the strategies, I think if we're following those basic 4 steps that you brought up earlier, Tony, it's just about being consistent with how we work amongst different athletes, but also if that's the building block for how we're going to train today and how we're going to train 3 months from now, for a lot of people, it just requires repeat exposures to the same information, but now varying it based on, what their capacity for work is.
Mm-hmm. Yeah, no, that's great. And I think, too, I don't know if we highlighted this, but when it comes to the different professionals that you might be involved in and where, the corrective exercise or return to performance specialist may fall, you've got the rehabilitation professionals, right? You've got the physical therapists, athletic trainers. Through that rehabilitation process, they're going to be focused primarily on the site of injury. One of the primary objectives is to get the individual to be able to return to activities of daily living. And then an opportunity for return to performance professional or corrective exercise specialist is to, increase the level of intensity of the activities and programming compared to what they experienced in rehab. When you look at a modified reconditioning plan, we highlighted this earlier, looking at the entire body. So the kinetic chain or regional interdependence approach. Not only are you going to continue to focus on the area where they were hurt, but you also have an opportunity and maybe a responsibility to look at other areas of the body that could ultimately impact and create more stress to the site of injury. Return to performance, it's a pathway to the demands of sport. And, it's an intermediate step to that full participation on the field of play and or strength and conditioning. So, from there, you've got strength and conditioning, where you might look at sports and position specific conditioning, modified and player specific movement prep, might be a slight modification to accommodate certain movement restrictions with that person. So again, it's that bridge between rehab and full strength conditioning practice and competition, where you can leverage those principles and strategies of corrective exercise and the optimum performance training model.
Right. So I think at this point in time we've overviewed the information as far as where the next 5-6 sessions are going to go when it comes to this, return to performance. So I think as far as our listeners go, as far as letting them know what's to follow, one of the things that we can look at on our next session is going to be looking at return to performance for foot and ankle. And down the line, we're going to address return to performance for hips, shoulders, and low back. And then we're going to go into some sports. Like, you mentioned earlier, Tony, you got a really deep experience when it comes to working with professional basketball and baseball. So those are the next two topics we're going to hit up when it comes to court sports, as well as rotational sports when it comes, to tennis and baseball throwers, and let's say somebody who's got a bat, or even lacrosse. So I'm really looking forward to the next, golf, especially golf. I'm really looking forward to these next 5-6 sessions we have lined up. But I think when it comes to just overviewing what we're going to discuss, this has been great information as far as what we as fitness professionals, sport professionals, need to know about what it takes to get somebody from an injured state back to full participation and play in whatever sport that they want to do.
Yep, no doubt. Got a lot to chew on and think about. Really excited for the subsequent sessions as well. So with that, I guess we can sign off. Thanks everyone for listening, and look forward to seeing you again soon for return to performance for the foot and ankle.
Yes.
Thanks so much,
Have a
Ken.
good one. Yep. Thank you, Tony.